In the news right now, we're seeing a renewed passion for mask mandates to return. So my question is, why are politicians and our health officials pushing for this resurgence of this failed policy? And question number two, were these policies even effective in the first place? Stay tuned to this little mini episode and let's get to it. All right, folks, so welcome to another episode here of the Never Kill Podcast. I want to touch on something that is going to, I hope, not have a dramatic effect on our lives like it did over almost a 3-year span from 2020 to 2023, and that is COVID-19 mandates and public health measures. I want to touch on the mask mandate thing because it's popping up all over the news, especially in the United States. And the first article I want to touch on to show that this is actually a thing, it's not just conspiracy. It's in Newsweek, mainstream media, and the title here is Mask Mandates Return, Full List of Places with Restrictions in Place. And before we get into this, guys, don't forget, if you're enjoying this content and you want to see more and support a veteran-run and operated business, smash that like button and make sure to hit subscribe and hit the bell for notifications when new videos like this arise on YouTube. Okay, so let's just take a quick look at what's going on here. So the two new COVID-19 variants, EG.5 and BA.2.86, whatever, have recently emerged. The World Health Organization classified the former as a variant of interest earlier in August, but reported that its risk of global public health is low. Okay, thanks, World Health Organization. The latter variant has only been reported in the US, the UK, Denmark, South Africa, and Israel, according to the CDC in the States. In a risk assessment summary, the CDC wrote that the BA.2.86 variant may be more likely to infect people with existing immunity to COVID-19, either from vaccinations or prior infections, than previous variants. Well, now that's interesting. So the people that got vaccinated are now more likely to get infected, but also the people that had it are more likely to get... I think by now pretty much everybody is in that bucket. Like, those Venn diagrams are really kind of meshing up. You've had it, you've got a vaccine. I think that's pretty much both circles. They're covering everything. So therefore, having immunity now is in effect. So therefore, really, the vaccines are completely useless. I don't know. Is that what we're saying here? So what's the next step is the next logical question. I'll let you come to your conclusions, and you can drop them in the comments right here. Why do you think that this is something that is being brought up, that immunity is no longer effective at fighting this variant? Now, on a side note, I don't know why they're calling this a variant, and I have to look at the definitions of variant and mutation, because from my background, if you have a virus that is no longer reacting, behaving like the old virus, it is now mutated. So I'm not sure if it's just a reporter that's using variant incorrectly, or maybe I'm just ignorant, but if there's somebody out there that knows the definition of the two and why they're being used as this is being called a variant rather than a mutation, please, I'd love to hear why. Okay, so that's in Newsweek. The next thing we're going to look at now is, were these things effective? Meaning, did the mask mandate actually have the desired effect, which was decrease the, essentially, death rate, right? It doesn't matter if you get sick. What matters is, are you taking up a bed in a hospital and are you dying? This is the whole raison d'etre for the mandates, right, in the public health measures, was to reduce the amount of carnage. Okay, well, I want to pull up mainstream media stuff, because if you don't, it's easy to say, well, that's just left-wing, right-wing, independent news media. I know we still have a fundamental belief that the mainstream media is the source of truth. So that's why I'm bringing up something from The Atlantic, a very mainstream media publication that said the case against masks at school. Districts should rethink imposing on millions of children an intervention that provides little discernible benefit. Okay, so I'm going to leave all of these links housed on Patreon. So I'm going to have a much more detailed set of notes. So if you haven't become a patron yet, you got to go to the Hard to Kill podcast on Patreon. The link will be here, and you can sign up for any tier of support, and you'll be able to access the full set of show notes, transcripts, and the links to all these articles. But essentially, this article is making the case that you can put all the interventions in you want for any kind of health measure, but is the juice worth the squeeze? And is the risk benefit reward profile any good? And you can go into this very well written article actually, and see for yourself, right? I don't want to tell you how to think, so therefore go read yourself. And this also touches on the reason for science existing. The reason for science is to seek out truth. And it is a systematic approach to seeking out truth. And it relies on paradigms. Paradigms are meant to change and shift with an overwhelming body of new evidence. And it's not the goal of science to stay entrenched in a certain way of thinking once there's enough evidence to the contrary. And that's when you have paradigm shifts. Now, if you can understand that, then it's really important that if for whatever reason you had a very strong stance and you believed the science, which was often said to convince you that if you didn't have the same opinion as the experts, you somehow were a misogynist, a racist. I'm just throwing things out there that, come to mind, not based on any real life events whatsoever, but that is very anti-scientific. But we've seen it all throughout history because humans are humans, right? Humans stay entrenched in a certain way of thinking because once you've established it, if you're proven wrong, it's much harder to admit that you were wrong than to just develop the actual idea or the actual opinion in the first place. And politicians, public health officials understand that. We understand that fundamentally. To be able to change your mind is one of the hardest things. Even though we have a very well-developed prefrontal cortex to be able to do that, it's important to be able to swallow your pride and be like, you know what? I don't think I was right on this. And the overwhelming body of evidence is showing to the contrary. So this is what this article is stating. And it's very well written, very well referenced. And then another one would have to be the New York Times article. Right. So again, another mainstream media article. I'll just grab from the New York Times here. The New York Times did a great job here because, again, they're typically the gold standard when it comes to news reporting. I used to be a very avid reader of the New York Times. So some of the reporters put out excellent, well-researched articles. Some don't. Okay, so just like any news agency, be able to think critically about what you're reading. And this by David Lionheart, not quite sure how to pronounce his last name, was, again, another very well-researched article. It came out in May 2022, and it kind of blew up the internet a little bit because the New York Times was a big proponent of masking and towing the company line and making sure that everything the government said was promoted. But all you need to do is just look at the body of evidence. And although cases were rising, it was clear that putting on a mask was not having the effect or the desired effect that was intended, which was reduce infections and reduce hospitalizations and reduce death. And the reason why he references Aristotle here is it's the idea that the sum of all the parts the whole is greater than the sum of its parts. And this is where I agree, actually, fundamentally. A mask in and of itself, I'll concede, does have the effect of preventing infection. Might be ever so slightly, but you can't say it doesn't prevent, because it does slightly prevent the transfer of droplets. Okay, so I can definitely concede on that. I was very like, this doesn't make any sense. But what I don't agree on, and this is what the article brings up, is that on an individual basis, they may work, but on a mass scale, they're useless. And I'll use the military as kind of as a test case for this. When we learn how to put on our protective gear, so our gas masks, our bunny suits for nuclear, biological, radiological warfare, it takes days to learn how to put that on. And that's what we call PPE, personal protective equipment. And it's serious because if you're in a situation like that, you need to know how to do it. You need to know how to do it well. So donning and doffing, my favorite word in the world, doffing, taking off. There's all procedures and you have to get trained on it. And I used to do the training when I used to train my troops, and I was trained when I was a troop. But it's a procedure. Like, you can't just do it half-assed, because you could potentially start doing the funky chicken if you're exposed to any kind of biologicals, right? But to apply that rationale that everybody in society, millions and millions of people, are going to do this one thing correctly every day, all day, without any training or guidance, is so insanely ridiculous that's where I drew the line. It doesn't make any sense. You're not going to get any benefit from this. And the evidence is showing quite reasonably that this is literally the case. And so I'll go and point out an episode that I referenced a few times way back when. And if you go to one of my earlier episodes, episode 86, I talk about, it was right at the time of the trucker convoy and what was going on. And the reasoning why I supported the trucker convoy was for a well laid out reason. Is because the logic of all of these mandates didn't make any sense. And people are just asking to bring back the normal. And one of the articles and one of the podcasts I reference is always Peter Attia's podcast. He is like straight down the middle, very logical, rational doctor. And he's got a great podcast and he has great guests on. So I don't pretend to be a super expert. I just want to convey the expert ideas and mentality so that you can have a plurality of ideas and thought. And he coined the term, or maybe he didn't coin the term, but I heard it from him, the alt middle. And I liked it because it's almost like being in the middle was like being like a fringe during this whole era. And I hope we're able to kind of bring back everything to the middle so it's not so polarized, but I'm not too optimistic on that. So that being said, in this episode here, number 192 of the Peter Attia podcast, it's called COVID Part 2, Mass, Long COVID, Boosters, Mandates, Treatments, and More. He has Dr. Marty Makary and Zubin Damania, Z-Dog, as he calls them. They're both doctors. And he also had Dr. Monica Gandhi on, an infectious disease specialist and professor of medicine at the University of California, San Francisco. And what was really eye-opening from this conversation, Dr. Gandhi was an integral part of implementing the public health policies, mandates in the US. She said, in no uncertain terms on this podcast, that masking at scale is completely ineffective. The only time it's effective is for a very sick individual that may have immunocompromised system, like from cancer or any other disease. And they, and only they, should put on an N95 mask at a bare minimum to protect them from a heightened risk of infection. So this was public knowledge of the public officials that were saying we shouldn't be doing this at mass scale. Healthy people, it doesn't make any difference. Old people that are sick or that you have can't. Yes, but it's personal protective equipment. Again, it's a personal choice to put your mask on. So if you do it, cool. I don't care. Walk around all day. Drive in your car with your mask on. I don't care. I also don't care if you wear body armor all day. I don't care. You can wear whatever you want. You can protect yourself however you want. Just don't impose things on individuals when it's a personal choice. Now, I don't want to get into the libertarian debate like, oh, well, what about like seatbelts? Okay, I understand. Like, we can go down. But what I'm saying at a face value here is that this policy of bringing in masks was clearly a failure. It's been mentioned numerous times that it was a failure. So then the question is, why would anybody in the government or public health officials even decide that this would be a good idea? And if we go back to the article here with Newsweek, mask mandates are coming back in the United States. At Lionsgate headquarters in Los Angeles, that's where that is. Yeah, I think that's a movie company, right? And Kaiser Permanente in California, it's a healthcare company. And United Health Services in New York, Auburn Community Hospital in New York, Upstate Medical Hospitals in Syracuse. They also need to be in New York and California. And Morris Brown College in Atlanta, they brought them back. So they're coming back, man. It's not like this was just a conspiracy theorist saying, oh, we're bringing it back, as Alex Jones talked about. They're literally back here at these places. Now, if anybody's at any of these places, I'm curious to know, are you going to comply with them, knowing that they're ineffective? And I want to make a stronger case against them in the future with some evidence here. So the 1918 flu, Spanish influenza, was a pretty big deal. I think something like 500,000 Americans died back in the day, but there wasn't 300 million Americans, right? Significantly lower population. It wiped out a lot of people across the planet. That was just a massive, massive pandemic, like a true pandemic in the sense that like we're stacking bodies in the streets. Well, a paper came out from the National Institutes of Health that is titled "Bacterial Pneumonia Caused Most Deaths in 1918 Influenza Pandemic." So that's interesting because influenza from this study was one of the factors that reduced the capacity for your immune system to fight off other infections. And they're saying that bacterial pneumonia was actually what knocked you out, which is pretty interesting. And in this case here, what was interesting about the 1918 pandemic was that there's young and old, actually younger fellas were dying. So guys my age, a little bit younger, were actually being affected. Not like this last COVID one where it was, I think the average age of death, and don't quote me on this, was 76 or 77 if you die from COVID. So therefore, they aren't quite the same. And the reason why I bring this up is because there's a curious bit of, I guess, questioning that needs to happen here. Well, how would individuals get bacterial pneumonia, right? Because that's nasty. And we get pneumonia here, but we clear it up with antibiotics. They did not have antibiotics in 1918, right? So it made it so that it was extremely deadly. Now, let's go down this rabbit hole a little bit. So mass resistance was a thing in 1918. It wasn't anything new, but they did have mask mandates, okay? They deployed all the same tricks that they used this past time with calling you out as being unpatriotic, being, in this case, a slacker, which I guess in 1918 was a badge of shame. I think now the Gen Zs are probably like, yeah, bruh, I'm a slacker. But they deployed a lot of the same stuff. And this is from Michigan Medicine, University of Michigan, michiganmedicine.org site. The goal here was to convince people that wearing a mask was the only way because, again, although the sanitation movement had already started and was pretty well implemented, everybody pretty much knew like washing hands, staying clean, stuff like that would prevent diseases. They didn't have vaccines like we do. They didn't have antibiotics like we do. So the only thing that they could think of was putting on a mask. And in this case, it was cloth masks, right? There was a lot of pushback, and I'm reading here. It's pretty cool. You can read for yourself, but there was like riots and all kinds of pushback, and they couldn't really get people to comply. And people were doing the same thing as we were during the mandates, like cutting a hole in it so they could smoke a cigarette. Like humans do human stuff. So it was just not effective. But the curious thing is they're all wearing cloth masks, kind of like we were, right? We're reusing our cloth masks over and over again. Some of us were using disposable ones. So let's look at what this means in the grand scheme of things. So I'm looking at a paper here published in the National Library of Medicine for Biotechnology and Information. So it's the NIH in the States. And it's in the paper Frontiers of Medicine. I don't know why I said that weird. In 2021. And the title is called Cotton and Surgical Face Masks in Community Settings, Bacterial Contamination and Face Mask Hygiene. Okay, cool. So I bring this up because, well, is there a risk of there being a lot of bacteria on a cloth mask? What's the evidence? Well, the evidence is saying, actually, yeah, it's pretty bad. So they tested cloth masks that weren't used, and then they also boiled them and left them out to dry and then tested them again after 4 hours of use. And they were measuring massive quantities of bacteria on these things. So bacteria like Bacillus staphylococcus, Acinetobacter, Paracoccus, Aerobacter, Streptococcus. These are all the nasty ones. And if I just read a part of the study here, So from one part of the discussion here, cotton or cloth masks are known to be a good substrate for microbial growth and to hold moisture very well, which is in line with the results obtained in this study and is also observed by others. Other studies have shown that the material count on face masks of surgeons was directly proportional with the operating time. Therefore, we hypothesized that the bacterial load would be even greater after 8 hours, which is the maximal wearing time recommended by the government. However, people indicated to wear it even more than the recommended 8 hours. So moving on. For example, for Staphylococcus and S. epidermis and S. warnii, a whole bunch of different ones, and Staphylococcus aureus are also known as pathobionts causing inflammatory skin conditions such as atopic dermatitis and acne vulgaris. Staphylococcus aureus is also a colonizer in the airways due to the expression of surface adhesins and is known as a commensal bacterium, as well as an important pathogen causing respiratory tract infections. Additionally, Acinetobacter is also considered a part of the healthy human skin and respiratory microbiome. However, other members of this genus, such as Acinetobacter baumannii, can cause wound infections and pneumonia. Okay, I'm going to really leave this up to you. I want you to try and dive into this paper. There's a ton of research on here. It seems to be really well researched. And just to confirm the conflicts of interest and funding, so that it's not something that is, seen as something that's either skewed by money or some kind of organization. There's no conflict of interest reported. And there are no known donors that would skew this data, okay, from the study itself. Okay, so to put that aside, we're seeing that wearing a cloth mask especially, I'm focusing on cloth masks here because 1918 they were wearing cloth masks. Most of us were wearing cloth masks because we wanted to reuse them. We didn't want to keep on buying the new ones. Has shown that there's a massive uptick in bacteria that will be residing on these things, and therefore we're breathing them in. That's not a good thing overall, especially because we know that a lot of these bacteria that are on these masks can cause things like pneumonia. Oh, crap. All right. Well, let's look at another issue with wearing masks, and that is measuring the quantity of harmful volatile organic compounds inhaled through masks. And this, again, is at the NIH website, and it was a paper published in Ecotoxicology Environment Safety in 2023 of May, so this year. What they're noticing is there's a massive uptake in volatile organic compounds by the body when you put these on. Volatile organic compounds are the things that can cause things like asthma. They can cause inflammatory responses. When you get into a new car, that new car smell, those are volatile organic compounds. In small quantities, not the end of the world. But when constantly exposed to them, when constantly inhaling them, they can cause the conditions I was just talking about. So these disposable masks were studied, and big picture, you're getting way too many VOCs in your lungs. Like so much that it is well above the standard. In this case, they were using a German standard because it's a European publication for acceptable levels of VOCs. And so we're putting these on our kids every day. What were we thinking? They aren't meant to be worn every day. A surgeon wears it when he or she does surgery. Do they do surgery every day for 8 hours? I don't think so. 4 hours? Maybe. But at the end of the day, there's a significant health risk here that we're not even considering. We're saying, yeah, just put these things on. My safety, don't get me sick. And this is where we've completely lost the plot. There is evidence that shows that these things don't work. There's evidence to show that they actually can cause harm. And at the end of the day, it should be your responsibility to protect your own health. We're not even talking about the fact that if you were just literally healthy, the mask would be inconsequential in the overall scheme of keeping people healthy. Because if you're physically healthy, it is overwhelmingly more protective than any mask you can put on. And so what's the point then? I'll ask you that in the comments. What do you think the point is then of your health officials wanting to bring these things back? And I think here in Canada, we're likely going to start thinking the same way the Americans are, because like in lockstep, as soon as the Americans start doing something, oh, I guess we got to do it too. Oh, we don't have any evidence to it. Oh, but I'm sure the Americans do. We'll just follow along. It's like everybody's getting marching orders all from the same person with no rhyme or reason or no logic. And I think that's where we're going to wrap up today, guys. I'm just going to pump the merch store, if you'll let me. Just having a coffee here with my Hard to Kill mug, which you can get on the merch store. I'm also rocking the trucker ball cap. There's also another one, brand new. I just haven't got it yet. It is a podcast ball cap, which I'm really excited to get. So I'll be showing it on the next episode for sure. And for all those folks that are talking about supporting the troops and yeah, we got to support our troops and we got to make sure that they get their justice. And yeah, I agree 100%. The only thing is saying it and doing it are two different things. And if you really want to support the troops, I'm going to call you out. The best thing you can do is support our businesses. So like, subscribe, share these podcasts, buy the merch, go find your local vetrepreneur, go buy their stuff, go actually vote with your dollars and support the organizations, support the businesses that are now getting bigger, stronger, and we need as much of you to say, yeah, buy veteran first, so that we can build our community stronger and thrive into the future. All right, so that's it for me. Don't forget to train hard, fight easy. I'll see you on the next one. Peace. I hate t-shirts that get floppy in the arms after 10 washes. So that's why I created a bunch of t-shirts with high quality cotton just for you so that you can go to the gym and look fresh, sport some philosophy, and smash those PRs looking good. So you need to head to davemorrow.net/merch, grab yourself a hat, grab yourself a t-shirt, grab yourself a sweater, and support the cause today.